Good evening, everyone. It is 6 o'clock, so I'd like to call this meeting to order. We do have a quorum, and I would ask Dr. Welly to lead us in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I'd entertain a motion to adopt the agenda. All those in favor?
Aye.
Any opposed? Takes us to patron comments. All right, any school district patron may present information to the board at this time. Presentations will be limited to no more than 5 minutes. The board will not take action on any issue not included on the published agenda. However, all comments will be taken into consideration by the Board of Education. Patrons are requested not to discuss individual faculty, staff, or students. Patrons are reminded that this is a public forum and comments relative to individuals could result in litigation. However, any patron may request to meet with the Board of Education in executive session. No response will be given by the board at this time. Jan Brill, looks like you're on deck.
Good evening. I rise tonight in response to the gentleman who spoke to you at the last meeting, who expressed his concerns about pockets of liberalism in our school. I rise tonight to say I have deep concerns about pockets of conservatism in our school. Given the fact that you have the two sides represented with concern, I think you should conclude that we're probably right about where we should be. Thank you.
Thank you. That will bring us to reports, and the first is health coverage.
We are pleased to have Jack Noble with us tonight with Mercer to share the background of our plan and our CIP CKC network. And we're also joined by Gary Abram, who is our administrator for the program. So, and then Dr. Gooch is also going to help us out. So if we would have Jack, if you'd come on up.
Go to the podium if you'd like.
Evening.
So I'm going to kick us off real quick just to kind of give, this is the agenda that is going to go through. I just thought that to go ahead and before Jack talks about his role in the insurance pool, I was just going to give a little bit of background specifically to the SIP GKC insurance pool that we are a part of. So the self-insurance pool of Greater Kansas City was founded back in 2012 by a few school districts. Current members of that pool are Blue Springs, Fort Osage, Smithville, and Grain Valley. The unique thing about our specific pool is districts have the ability to set their member contribution rates, which is also the same contribution rate that retirees pay for their monthly health insurance. So it's a benefit for our retirees. Some of the other just important information or pieces that I thought I would share with you guys, with us being in the self-insurance pool, we have the capacity to, because of that, we have lower administration costs than when you would go out to typical open market plans. In some cases, open market plans can see administration fees in around 20%. They have to stay below 20%, but they're typically that high. Ours is right at 10%. And there's another thing that I know that Jack will speak to in a little bit. With us being in the being self-insured, we have the ability to get pharmacy rebates, which are not available to open market plans, which again he'll speak to, but that saves the self-insurance pool a tremendous amount of money. And then the other The other thing that I think is a tremendous benefit for the individuals of our school districts that are in the self-insurance pool is our access to the Consiglio Wellness Center in Blue Springs. Just to show you on that slide, last year we had 15,000 visits to the Consiglio Wellness Center. So if you think about that, it's very inexpensive for someone like myself to go there. It costs me $10. Whereas if I were not feeling well and I would go to my doctor's office, I would have the reduced rate from whatever the office visit is, but it would cost me, I'll speak specifically to mine, I know it cost me $140. So that is a benefit for me to be able to go to see someone when I'm not feeling well, get good medical attention. They can prescribe medications, and for me to only have to pay $10 versus $140, when you figure that out times 15,000 visits at the Consiglio Wellness Center on average each year, it's something that is a tremendous benefit for our people as well, and that is only available to members of the self-insurance pool of Greater Kansas City. So I just wanted to give a little bit of background based off of SIP GKC. You'll hear me refer to it as that a lot. And then now I'm going to turn it over to Jack Noble with Mercer, who's here to give you the rest of our discussion tonight.
Thank you. Again, I'm a lead health and benefits consultant with the Kansas City Mercer office. I've been with the firm 13 years. I've been in the business 30 plus years, in Kansas City 26 years. What I was asked to do today is to just kind of introduce some of the projects, some of the work that we've done for the self-insured pool of Greater Kansas City over the years. I've worked with the pool for the past 3.5, 4 years. I've managed many multi-employer plans and pools similar in size and scope and complexity. What's unique about SIP is it affords an organization the size of Grain Valley to purchase at the scale of 3,000 or 4,000 lives. So if you'll imagine when you're buying something, the ability to buy with greater scale makes you just much more efficient. And that's really the mantra of SIP GKC and what we work strategically and tactically each year, what we work with Gary and each of the districts to frankly accomplish is we try and make the pool as efficient as possible. What we've found over the years, and we're going to get into this in slides, is when you're self-insured, when you're working with an administrator that's simply paying your claims as a plan sponsor, you need to spend money to be hygienic on a year-over-year basis. And that's just kind of standard stuff that you need to do as a plan sponsor so you don't get into trouble. With that said, when you're larger like this and use economies of scale, you're afforded other opportunities like the ability to audit claims at such a scale that you can find dollars, so you can actually spend money for return on investment as a plan sponsor. And that's what I've got up on the slide here today, is we've kind of gone through a number of projects from medical administration that we accomplished a number of years ago to network, to variable fees, different actions that we've taken on behalf of SIP have used dollars in that year to find additional savings dollars for SIP in total. And so we highlighted one specifically having to do with pharmacy benefit management, where you see the greatest amount of, let's call it movement on a per capita basis in the Kansas City market over the past 3 years has been in drugs. More and more medicine is being practiced through a Walgreens or a CVS. So you as a plan sponsor, you have a component of your medical plan that you're using via Cigna, which is your medical administrator, their drugs. And so what our job is our pharmacy practice audits what they do on what's called a carve-in or a carve-out basis, meaning do we trust Cigna's deals compared to the open market or a coalition of pharmacy benefit managers, or do we want to try and go to another medical administrator like an Aetna or United Healthcare or somebody like that? And so over the past few years, we've undertaken a variety of different avenues looking at that. And so I highlighted in 2023, just in that 1 year, when we looked at, and the prior year we had looked at medical administration and pharmacy administration on a carved-in basis, and using leverage with another medical administrator at the time, Cigna lowered their PEPM administration fees for you guys. They lowered their cap for what are called variable fees or shared savings arrangements, so on and so forth. And then the next year, we did the exact same thing, and we went to Mercer's coalition of the 3 largest PBMs nationally, and we ended up saving in that year about $750,000 spread across all of the districts. So those are just examples of kind of areas, or let's call it practices, that we have employed on behalf of Green Valley. And I can tell you, we have looked at your arrangement from, let's just call it proportion of dollar spend, and how efficient you guys are as a pool. And you are about 5 to 10% more efficient than if you went out there on your own. That's just basically what it comes down to in a nutshell, is you would have to pay for the administration and what I would call margin, which is claim fluctuation that you need to cover when you have a plan sponsor that's self-administered. Your arrangement today is about 5 to 10% more efficient than what you'd be able to buy on your own. And that's kind of the nutshell. Any questions about the past projects? Because I can certainly go into detail about any of them. Okay, next slide. Uh-oh. There we go. Effectively, what this is talking about is our benchmark. So Mercer is the largest health and benefits firm worldwide. We employ more actuaries, credentialed actuaries, than anybody in the United States. And effectively, we conduct 2 of the largest gold standard surveys of plan sponsors like yourselves nationally, and we release that information to Department of Labor as well as Congress. And it's a statistically valid benchmark. So what we've done is we've taken a look at your costs and compared them to similar plan sponsors that are public, like Green Valley. And what you can see there is you are in a better position from an efficiency perspective. And that's really all it's trying to point out. And so we're looking at overall cost, and then we're also looking at what's called actuarial value. And what I mean by that is, you as a plan sponsor, if you spend $1 and the actuarial value is 85 cents, that means Green Valley as a plan sponsor spends 85 cents and the member shares 15 cents. And so in both instances, you guys are in a better position than the benchmark would demonstrate. Versus, again, we're talking 2,000-3,000 other plan sponsors that participate in this survey. As well, over on the right-hand side, again, the assigned actuary, Ted Hoffman, was going to be here tonight. Unfortunately, he was ill, and we didn't want him to come in here and infect anybody. So I'm doing my best to kind of cover his slides. Effectively, you've got a couple of risk mitigation techniques. The real, area that's most used for organizations of your size is stop loss. And all that means is that you're buying protection for individual claims, very large claimants on an annual basis. And so you can see that today the specific stop loss that SIP enjoys is $300,000. That sounds like a very large amount of money. I can assure you that hospitals, when they bill, their actual, let's call it cost of goods sold, their charge master is almost double or triple that amount. So Cigna has negotiated on your behalf as someone that rents their network, and you're getting an effective discount. In Kansas City, discount with Cigna for inpatient services, to give you an example, is around 68%. So we're talking about a very hefty discount. And so that stop loss, when you have a $300,000 hit, we're talking about $1 million claim that's kind of coming in the door, if that makes sense. And then you're buying $300,000 of it. And then from that claim point on, the coverage kicks in, and the insurance company covers the rest. Any questions about specific stop loss or actuarial value or any of the benchmarks? No? As well, I think a question was asked whether or not we conduct, let's call it statistically valid Monte Carlos, or whether we look on your behalf, whether or not you are pegged at the right amount in terms of risk. And it's very important from an enterprise perspective, a plan sponsor's perspective, to really use the law of large numbers to figure out whether or not you should buy more risk or offload more risk out in the open market, because you're paying for it. It's just healthcare financing. That's what, when you're buying stop loss, which is that excess coverage, you're actually just healthcare financing on the front end. So you use a statistically valid method or methods to develop a Monte Carlo study. And what you see here is you see two different examples demonstrating whether or not Grain Valley, from your own information, whether or not you would have claims in excess of $300,000 in a, let's just call it, I'll make the math easy, in a 10-year period. You have two boxes. One is saying that in a 10-year period, you would have 3 years out of 10 where you would have a chance of, let's call it, having claims in excess of $300,000. Whereas the one below that, it would be in a 10-year span with a 5% profitability, you would have 1.7 years where you would actually have claims in excess of $300,000. So what we're trying to do is develop a bell curve and then hit the midpoint to say, should you pay more and buy more risk, or should you pay less and offload that and pay for that yourselves, if that makes sense. Any questions about stop loss or the Monte Carlo studies that we do on an annual basis? Because we shop stop loss every single year. And so conducting this study is just kind of part and parcel or table stakes for us on an annual basis on your behalf, as well as the pool.
Any questions in general? So I have a few, I guess, and mine are not related to the actuarial component. It's more about the plan in general.
Sure.
So we're part of the consortium. The consortium is 3 districts, 4 districts? 4
districts.
Okay. Do we all have to carry the same plan design?
No.
Tell me a little bit about the plan. Are there 3 different options in our plan?
Gary, if you'd like to step
Yeah.
up there with Jack as well, you're more than welcome to.
Sure.
So, I mean, to be quick, and I can let Gary Abrams speak to it more specifically, to answer your question, no. We can,
You have actually, I think, 4, but one of
Okay.
them is barely, I think there are only 1 or 2 legacy contracts. And, but we do not, across the spectrum of our members, they're very similar, but there's variations in terms of deductibles. But we have a narrow network, which is certainly the most price or cost-effective for the member. And then we have what used to be called a HMO plan or a PPO plan, but this is in our parlance, it's an open access plan. And then there's a buy-up, which has a lower deductible. So as a board, you all designate what your base plan. And at this time, I can get my wires crossed here, but I think that narrow network is your base plan now.
it is.
Yeah.
It is.
Yeah.
Okay, so we've got 4 plans then, or is that-
Really, three
Three,
that
okay.
are active, right?
So, yeah, I think 3's plenty for most employers. Three sounds about right.
We agree.
So we've got 3 plans effectively. Our retiree population is also in those 3 plans. They can pick any of those 3, just like anyone else. Is that
So the
true
Missouri
statement?
statute protects the school district retirees, and they mandate that your retirees have an option, the same option that the actives have.
So there?
And so now we collect on your behalf the retirees. I think that you have about 20. And,
20 retirees?
20 retirees.
It's about right. That's, yeah.
Okay.
And most of those are single contracts with the base plan. So I think there's a few husband and wives, but for the most part, those retirees are in the base plan. The other thing to mention is we're always hopeful that when they reach Medicare qualification, that they look at that, because typically a Medicare plan, even with a supplemental, is going to be a better situation for that retiree. But it's very typical in our entire pool that the folks stay in it. And I think across all of the districts, we have over 200.
So there's no requirement that a retiree at age 65 move to a Medicare plan. They can stay on our plan.
It's not advisable from their checkbook standpoint, but no.
But there's no
No,
requirement that,
no, we don't kick them off.
okay. When we look at the broader numbers on a monthly basis, our claims trend appears to be all over the place. Year over year, are we, tell me a little bit about that. Year over year, are we seeing significant spikes? I believe 2 years ago, we saw what felt like a pretty significant spike for us. Do we have a claims trend issue? And then my follow-up question is really looking at the numbers. I'm questioning whether there's a severity problem or a frequency problem with claims.
Okay, so you, as a plan sponsor, Green Valley is not unique. High-cost claims, so imagine your population being 100 people. 5 people out of 100 spend half the cost. That's healthcare in the United States, okay? And so you've had a couple of very large claims, let's call them $1 million claims, okay? So from a financing mechanism perspective, yes, it feels very severe. It is not unusual. Treatment therapies for those high-cost claimants, claims in excess of $100,000, are escalating. Their inflationary rate on those claims is between 15 and 23%, depending on if you're getting into medical or pharmacy or specialty drugs. Regular old doctor visits, I think you guys have, the pool has run at a negative trend over the past 5 years. So regular old stuff, nothing. You're just running along. Those high-cost claimants, however, those have become, so you don't have a trend issue. You have a couple of very expensive treatments, unfortunately, or sick people, that these are life-changing, right? So I'm not saying you don't want to do it, but they're just very expensive.
Okay.
So this is year 13 of the pool, and Green Valley did very well for a long period of time. And in fact, a number of years you did not raise your premiums. The last couple of years, they've been extraordinary. Now, looking at all the 4 districts, they've all experienced that same phenomenon where they'll have a rough patch. And typically, or hopefully, before that happens, we hope that you build up a reserve. And in the case of the last couple of years, you had a newborn in the last 12 months that had 2 operations. And one claim was $1 million, and the other was $800,000. And so that's one of the drivers of this past year or so, which was very extraordinary. Now, our stop loss cut the economic or the financial reckoning to $300,000, but those occurred. Now we've, over the 13 years, we've rarely seen that. We have very few 7-figure claims over the years, but I think back 6 or 7 years ago, Blue Springs had two $2 million claims. Again, the stop loss protected above the 300,000 level, but they do occur. Now, from a frequency standpoint, I don't see anything different over that period of time. What has happened, though, and Jack mentioned it, when we started the pool in 2012, the pharma side or the RX side was about 10% of claims, and now it's over 30%. So in a way, that tells you what's going on with healthcare. But our medical, we take out the RX, and Jack just mentioned it, across the pool, we've had zero trend, actually 0.4% decrease, which is unheard of. I mean, that has been very fortunate for the entire pool. I will say, unfortunately, Grain Valley over the last 5 years, really the last 2 years, has had a rough spot. And based on our experience, that's going to trend back. But in the recent times, you know, I hate to be the bearer of bad news, but sometimes when I've had to call Nick, I felt like I didn't want him to shoot the messenger. But you know, all of our experience says it should regress to the mean.
So, and I can certainly add this, from a surveillance perspective, Gary, on behalf of SIP, has tasked our clinical team, because we have a population health practice. So we have clinicians that kind of dig into these claims to ensure that there's no waste, there's no fraud, that the treatment therapy is not, you know, you don't want to spend, for the guy for Jack's got Hep C, and I start $75,000 treatment, and then I go to Cancun and I ruin that $75,000, stuff like that. You don't want that to happen. So you want a clinician to look over their shoulder, and that's kind of the stuff, some of the stuff that we do.
So with regard to the stop loss, that covers a fluke claim, not necessarily a condition, right? So it would cover a
not fluke.
surgery.
It's not flukes, because as we were showing those Monte Carlos, it's literally, you are, as a plan sponsor, you're large enough where you are, it is healthcare financing. You're gonna have some claims. There's always gonna be cancer, and you're not curing anything.
So strike the word fluke, okay?
Yeah.
My question really is that covering the PBM component of that, or is it strictly the surgery, or it's not, is it a condition that it's covering, or the surgery that it's covering?
It's, let's call it the whole kit and caboodle. Like, in other words, there's different billing mechanisms for different types of disease states. So whether that's a DRG or a global, or these, I mean, there's a whole revenue stream of the healthcare ecosystem that's very complicated. But my point is just simply this. The stop loss carriers are very accustomed to looking at that individual and that disease episode and saying, okay, this is covered. So that would include, you know what I mean? Like, they're not going to cover, let's say, you know, suddenly I have allergies or something like that, but they've been covering my cancer or something like that. Makes sense? So they're going to try and bundle that whole thing together, and that includes, you know, that person could be in an accident and treatment could last for a full year.
Okay.
So you're asking good questions, Mr. English. So our contract is what they call 1224. So when a service date, when a claim is opened, that starts the clock. So
Okay.
that coverage will continue past the contract date if the service is continuous, right? So we've had situations where unfortunately somebody might have two things going on in separate service times. But to answer your question, everything that's happening in that episode is covered, whether it's RX or hospitalization, inpatient, outpatient.
Okay. So you can bundle chronic conditions. I don't want to get too into the weeds here, but if somebody has obesity and diabetes, you could bundle those, and that would.
Very, very common for comorbid. How would you separate cardiac from diabetic from,
Yeah.
So they would mush that all together, and that's a claim.
Okay.
We had, talking about chronic, the one that I always think of is, goes back about 7 years, but it was a sickle cell, and the drug treatment for that's $400,000 a year. So things like that happen in a population. So to answer your question, it can be chronic.
Okay. So my next line of questioning, I don't have too many questions, but it's really, there's two components I'm concerned about, and as a board, I feel like we should be concerned about. And one is cost, and that's hard to deal with no matter what you do. The other is wellness of our employees. And I'd like to learn just a little bit more from you about what we're doing to ensure that we're identifying conditions before they happen and incentivizing people to utilize the benefit before it becomes a chronic condition. Can you speak to that just a little bit?
Yeah, so on the cost standpoint, I'll give an example from this past year. If you were a Blue Cross customer, for instance, their efficiency, they came in at about 78.5, and that meant that they didn't hit the 80% threshold of the ACA. And they had to pay money back to their insureds. We were at 89, so we were approximately 15% more efficient. I don't think there's a way that a school district in the metro area can have a better deal than what we've put together. I'm really proud of that, and it's because of you all. From a wellness standpoint, we go remotely every year to every building in your district and every building in all of the districts. And we do free flu shots and we do biometrics. Now, from the biometric standpoint, we hope to identify some of those chronic conditions like a high A1C or blood sugar. And Cigna provides coaching. We provide coaching. We have in our CWC, that's what we call our clinic over on the North Outer Road in Blue Springs. We have 3 nurse practitioners, and one of them's a specialist in nutrition. And so we're always trying to find folks that we can help and coach. And, you know, as the population sometimes is good at accepting coaching and otherwise not. When, for instance, when we talk to a district that's interested in joining us, they'll say, well, what is our wellness budget? And usually the carriers that they're with currently, it'll be 20 or 30 or 40,000. And my retort to that is that the pool, through how we finance the CWC, our investment is about $1 million. So why I say that is that we have carrier credits of about 200,000. We have co-pays of about 150,000. And then all of the other cost of prevention and wellness really comes out of what I would call deflected claims. So we chart everything that we do in the CWC. And Nick mentioned that typically we'll have about 15,000 patient interactions. And when we average all of those patient interactions, it comes out every year about $100 per interaction. So last year, we saved the pool from a claim standpoint $1.5 million. And our investment in that was about $500,000. So we get a 3x return on investment for our CWC. So when we talk about wellness and prevention and how do we help our population stay well, that's our big investment, which is our CWC. And then we also do some programming in the districts. It's, candidly, it's really, school populations typically, our demographics, our average age is 39. We're 65% female. Most of those members tend to, when the school day is over, they go home. A lot of them are moms, and we do try to do programming. But what we've found over time is that the best thing we can do is protect their health through early intervention through the CWC.
Okay.
There are certainly, each year, we work with the board, and we talk about different potential avenues. So certainly, and that typically is on an annual cycle. And we bring to Nick and the other folks from the other districts what we see as innovations that are happening in the market. I can tell you that the clinic that you enjoy is, I wouldn't call it, it's advanced, it's not differential equations, but it's definitely, it's up there compared to a lot of plan sponsors. They're, smoking cessation, that's kind of their idea of wellness kind of thing. So you guys are ahead in the game, but certainly, as you guys look into 2026 and beyond, if you're interested in potential other areas, obviously we can bring you, let's call it best practice for innovation, or take into consideration kind of directions or tactics.
I think one of my biggest concerns is our plan designs, and it sounds like they're consistent with the other members, but are they benchmarked against districts, statewide, and are they?
So we have the benefit of Mercer's book of business, and we have the benefit of Cigna's book of business. How the districts around the region have handled this is they have cheapened the actuarial value of the plan. They've shifted more of the burden onto the members. We haven't done that from day one. So your deductibles are, if you look at across the region in terms of all employers, et cetera, you have a really nice, rich plan for your members. And if they want to buy up, they can buy that deductible down. But everything we do is about efficiency and trying to take the money that your board sends us to pay claims. We're putting almost 90 cents of every dollar against claims. And most of the districts, if they're in a Blue Cross is they're the dominant traditional plan in the marketplace. And as I said, they only put about 78 cents of each dollar against claims. So they've got overhead, big buildings, ads that you see run in the newspaper and on TV, sales commissions, overrides to their brokers. We have none of those. Our overhead is as light a footprint as possible, which then allows you all to continue to provide really great benefits for your folks. And so one of my disappointments is people haven't knocked our door down to join because they are sort of stuck in a traditional plan. One of the negatives from a district standpoint is predictability. If you go to a traditional plan, you know what it's going to cost you during the year, but you don't know what it's going to cost you the next year. There are no free lunches. Insurance companies are not charitable. So you all are the owners of this pool. I'm just the administrator, and Jack's our consultant, and we strive to build plans that you approve. And so I'm sure we could lower the cost of a particular contract, but that would just mean shifting that burden over to the employees.
Well, and if I understand you correctly, it's really not a frequency issue.
No.
So it's not going to solve the problem. It makes things a little cheaper, but it doesn't really impact
Yeah.
claims cost.
You hate to talk about luck, but there's such randomness. We have districts that'll have a great year and then, turn around and have the misfortune of having a couple of large claims, and that will skew the numbers. When we look at our performance of our pool against the entire Cigna book of business, they marvel at the results in terms of drug compliance, knowing their numbers and doing something about it. And so I wish there was, Nick and I have had this conversation on a number of occasions, is there something we're missing? Is there something we could do that would bend that curve? And as Jack said, about 60% of our claims are going to come out of 5% of our population. The 80%, actually 17% of our population have no claims. They don't go to the doctors. About 40 or 50% are very profitable, very profitable. And if you look at the 80-20 rule, if we only insured those top 8 or the lowest claims 80%, we'd sure make a lot of money. So the situation that we've seen with Grain Valley the last couple of years has really just come down to about 4 or 5 situations.
So I'm going to wrap this up, I promise.
Oh, thank you for all the good
The,
questions.
back to the retiree component, I had always kind of suspected that that was driving some of our claims. That doesn't sound like that's the case at all.
I look at that I watch it very closely, and they might be 15% higher, just generally, but it's not real spiky. You know, I won't tell you how old I am, but you know, when folks retire, that's when their claims start to mount up. There are other populations within school districts that are equally or more troublesome.
But your high-cost claim has been not necessarily tied to age or infirmity associated with age. They're really just random illnesses with very expensive treatment.
So I could go on and on, but our top 3 issues every year are the same 3. MSK, musculoskeletal, cancer, and cardio. And this past year, that was the first year that MSK went to number 1. So typically it's been the cancers that have really driven the high-cost claimants. We had the baby this past year, and that was, and I spoke to the clinicians about this, and they basically said that efforts were heroic, in line with from a cost standpoint, and also a very strong likelihood that this baby will have a normal life.
Excellent. Any?
Yeah, just a couple questions. I will be a little more brief than Mr. English, maybe. You had referenced a 7-figure claim and then a high 6-figure claim. Just so I understand, the stop loss, the district would have or was liable for $300,000
That's correct.
of each claim. So if we're outside the district, there's an individual in town, not a staff member. And let's say their total out-of-pocket's $10,000 a year. And that individual runs into the exact same scenario. What would their out-of-cost be as an individual, not on the plan, not with the district financial backing?
Well, go ahead.
Does that make sense? So if the individual had a 7-figure claim,
If they're had to buy that treatment retail,
and they don't have $300,000 stop loss for their out-of-pocket, what would their invoice be?
Are they insured is the first question.
Yeah, so they're insured
With
with
somebody.
somebody else.
Okay.
They pay
Because
their
if-
monthly premium. How does not a normal person, but how do normal people, how do they handle $1 million claim?
Well, if they're insured, they probably, I don't know of a legitimate insurance company that doesn't have an out-of-pocket maximum, okay?
So let's say their out-of-pocket maximum for an individual was
if
$10,000 a year.
Well,
well,
if it,
the claim, the question for me, and I want to be sure that I'm clarifying from you, the claim itself, the cost of the claim, okay,
Yeah.
is not going to change. Meaning the treatment therapy at Children's, at KU, at whatever hospital, right? It would depend upon the network, okay, that is being accessed for that individual. So for example, for Green Valley and for SIP, we use what's called a statistically valid tool called NetPay. What it does is it takes Green Valley's claims from the past 12 months for every single claim. And it basically says, if you were with Blue Cross, if you were with Aetna, if you were with United, or you're with Cigna, who has the best deals for that client over the past, because I can't tell you what your claim's gonna be in the future, but I can look in the rearview mirror and see where we've been.
Yeah.
So that's kind of how we do it. And I can tell you, your network was 3% for aggregate, and the total spend is $40 million.
Yeah, so what I'm getting at, so I'm an individual in the community, something life-altering for a newborn child. It's $1 million incident. Do I get $1 million bill, or what do I
If
owe?
you have no insurance, yes, you do, but then if went to St. Luke's.
Okay, so I
it
have,
it would be written off because you don't have the means to pay.
okay, so I
Otherwise,
have
it would put you into
insurance.
bankruptcy.
So I have insurance as an individual. I receive $1 million bill. I am insured. What would I owe as an individual?
Well, again, if you have insurance, you're typically gonna have an out-of-pocket and an annual out-of-pocket maximum, whatever that plan sponsor. So if you worked for, another school district, if you worked for a big construction company, or you worked for the local Midas shop, the reality is they may have a plan that has a $5,000 out-of-pocket, $10,000 out-of-pocket, $20,000 out-of-pocket, and that would determine how much you would owe of that bill. Now, that plan sponsor, the Midas shop, the construction company, whatever, they're gonna deal with the exact same thing that you guys deal with within their insurance vehicle, whether that's via stop loss or what's called pooling, which is another mechanism that's used to offload excess risk within an insurance company's book. So there's different methods with which different plans are, let's call it financed, if that makes sense. And so if you're buying an insured product, right, you're gonna pay basically a fee for the fluctuation. So the smaller you are, the greater that fluctuation in the claims. So you pay a higher margin because the probabilities are higher that you're gonna have one of those weird claims.
Yeah.
So they literally, they hit you very hard. And that's why what Gary's talking about, this 10% savings, that efficiency, it's real. And again, that's the mantra that we get, is what is the most efficient vehicle for our districts, so they save the most money for teachers and for their administration.
Yeah, and so I get $1 million bill. I have a $10,000 out-of-pocket maximum annual expense. I pay my $10,000. There's $990,000 left on that invoice.
Yep.
And who pays that?
Well, again, if you're with a plan sponsor, right, they're paying a small premium. Let's say that Midas shop only has 10 people working there. Insurance companies probably via pooling, they're gonna eat that and they're gonna spread that across their entire book of business. Okay? If you don't have insurance, they write it off, and then what they do is they raise their fee schedule, so everybody that's using that hospital is paid for by everybody else that's gonna use.
Yeah.
So that $1 million claim, if they're insured, they'll get what's an EOB, explanation of benefits, and it'll lay all of this out. Now, from the standpoint of the board and you being a member of the pool, we're gonna, of that $1 million, Green Valley's gonna pay $300,000. And whatever the rest of it is goes to our stop-loss carrier. Right now, this year, it's Cigna. So we pay a premium every month to Cigna to protect the district from those losses above $300,000.
Right, but
So-
the hospital would bill for the $1 million claim. What I was saying earlier, it's probably a $2 million
Yeah.
bill.
Yeah,
So you're getting discounted 68% on average of that bill. So, does that make sense?
Yeah, so I'm not suggesting what I'm about to say. It's an actual question. If we weren't part of the pool and we decided to go with a different carrier, what would our financial hit be outside of the pool if those two instances happened? If we had $1 million and an $800,000 claim, what would the district financial responsibility be?
If you guys were on your own and you were insured,
Correct, correct.
my guess is you would probably have a pooling protection inside of your insured arrangement because of your size, probably around $150,000, $200,000. So that's how much would go against your claims experience in the development of your next year's renewal. Okay?
That would,
So-
and
so-
that would be spread out amongst all of the employees, or that would just be in addition to?
That's how they come up with your rate. So the way you develop the potential premiums that you're gonna split with your employees, right? You come up with their share and your share. The way you do that is, again, you look in your rearview mirror and you say, what happened over this past 12 months? And then we have go from the midpoint of that period to the midpoint of the next year period. And there's this math you do, and that says this is what the average cost should be on day one. And that develops your cost. So that insurance company, if you went on your own and said, I'm gonna buy an insurance product, first off, you'd paying what's called a super mature year. You pay for your previous year to get out of that deal that you're in, number one. The second part is you would now probably pay an additional 10% administration because you're not buying it with economies of scale
Yeah.
anymore. And then you're going to have to pay for higher excess risk or margin for those claims because now you're smaller and you're not buying as a larger pool.
You lose the PBM rebates as well, right?
And you're not going to get rebates.
And that's,
Rebates are about, for every employee, they're about $80 per month.
and yeah, and I appreciate the explanation. I think when you average out per cost of the employee, I think it's a great price. Mr. English was saying it's just kind of that, how do we control, or is there a way to control some of the additional premiums cost, you know?
Everyone right now, every plan sponsor of your size or significance or larger is struggling with high-cost claim treatment therapy. The costs.
That come down literally to a handful of very high,
Exactly right,
okay.
because now they're, Humira, Stelara, I mean, there's these drugs that are CAR T-cell therapy for cancer. They're life-altering, they save people's lives, but they're $2 million.
Yeah.
How do we bear that burden?
And I appreciate the explanation. That is the best news. What's more important than anything we're talking about is that baby having a normal life.
If you,
So I really do appreciate the
well,
clarification.
you're asking a really great question, which is what a board should do. What's the fiduciary responsibility of the board? To get the best deal. Based on your recent experience, if you went to the market, and you're certainly free to do that, you're going to probably see a 30% increase, just from what Jack, all your
Yeah,
premiums
yeah.
would go up 30%. Now, because you're a member of SIP, if Ted was here, he runs the numbers every year. He takes 3 years of experience and he says to Nick, this is what, if you were insured by Aetna, here's what they'd say the rate should be. Now, it's up to you to take that number and do with it as you see fit. We don't say to you from an administration standpoint, you have to take that number.
Correct.
So that's totally unique in this area. Everybody who's in a traditional plan is at the mercy of the carrier. And typically what they do, what a lot of districts do after they have a bad year, they go shop. And usually they'll find some carrier out there who will say, they're basically going to buy your business for 1 year. And a lot of times you'll have a 2-year contract. And so unless there's a guaranteed rate over that period of time, that thing could go shooting up sky high. So from the pool standpoint, we think this is an aberration for Green Valley. And we have not said, well, you've got to do this. We've said it's probably a good idea to take it up a little bit.
Yeah.
But it's your decision. And so what's happened the last couple of years, you've had a number of what we call supplemental payments, which are really just to make up that difference until things cool down. So I don't think you can find that anywhere.
Yeah, and I appreciate the partnership and the transparency and you all being here this evening, and the in-depth explanations. So.
Anytime you see a drug on a commercial, that's an expensive one. Keytruda, Humira, on and on and on. So if you're watching and usually they happen where there's like golf tournaments, 2 out of 3 ads are going to be for a wonder drug, because those are the people who are using those drugs. But if you see any commercials for any of those drugs, they're expensive.
Thank you again.
And we get a rebate on every one of those when they are prescribed.
So we just need to work on us getting a rebate then, right?
You get the rebate. Last year it was over $500,000.
Yeah.
So if you were in a traditional plan, you would have got 0.
Yeah. Thank you.
Any other questions?
Mr. Scully has a question.
Okay.
Can you all hear me?
Yes.
Okay. So the 2 questions I have are, this is kind of, for me as the new board those that are in attendance there, employee-wise, are we happy with the plan? In terms of this particular health insurance? Does that sound like most of the employees are happy with this particular health insurance?
So I scanned the room, and I made eye contact with 2 of the 3, and I got a very good head nod yes. And the other one gave me the, yeah, sure. So,
Okay, and then, just for numbers-wise, girls, gentlemen, sorry, your last page, page 9, can you hear me? I'm sorry.
Yeah.
Yep. Page 9 gives just that overall budget, we're looking at the board, paid premium per employee. Just out of curiosity, since we have the, $755 per month per employee, what does that equal to? And like, I don't know how many employees, I don't know if we're allowed to know that, how many employees are actually utilizing the health insurance, in terms of numbers for like, our just whether or not for the individual, family, like just out of curiosity, what the total that's coming in for this particular health insurance. I don't know if that's.
no, that's fine. Actually, this last page was generated by the district, and we have, and it will fluctuate. It can fluctuate a little bit if you have a person that is employed, in the middle of a month. So it will give or take a little bit, but I would say right now we are roughly right around 520 lives in our plan currently, and then there are a few retirees on top of that.
And we also run with, I'm guessing 12 months, like everybody's still, 12 months of premium.
Yes,
Yeah,
it's paid out
Yeah.
it's paid out over 12 months.
that's
Yes.
correct. That's correct.
Anything else? Gentlemen, thank you. Appreciate your time.
Thank you
Thank
very
you.
much.
All right, Dr. Gooch, I think you're up for the middle school sports, or is that Mr. Hart? We went long on that, so you're going to have 60 seconds. Go ahead. I'm kidding. Go ahead.
I'll serve this up, but we have asked Mr. Hart to join us tonight for this and the next item to answer any questions. So we wanted to kind of bring the school board up to speed on where we stand with middle school sports and activities, what we offer, where we offer it, and what we are growing in terms of opportunities for students, and our plan for what we can do next year and in the next couple of years, we believe. So on the first page, we just point out that we've got area school districts that offer most, if not all, their sports for their 7th graders, and we have limited availability in sports for our 7th graders at this point. We did add 7th grade basketball as an opportunity this year, and the 3 sports where we currently do not offer 7th grade is in volleyball, football, and boys and girls track. So on the second page of your packet is kind of our outline of what it would take. And essentially for girls volleyball, with the completion of the new field house at the high school, that does free up facility space for us to feel that we could add 7th grade to volleyball as soon as next fall. So there would be budget implication that we would bring to the board moving forward along with the rest of the budget in the spring. But that one is relatively low-hanging fruit for us. We feel pretty confident we can pull that off from a budget standpoint and a facility standpoint. The next ones are a little more complicated because both in the case of football and boys and girls track, we really do not have adequate practice space for the number of students that would add to those programs. So this kind of takes us to what we believe to be the next round of our facilities planning, which would be, we do not currently have an outdoor athletic facility for high school athletics. We do not have a full-size field for football. We do not have a track. Our middle school students track season, they use the outside 2 lanes of the high school track while high school is also having track practice. So the coaches all collaborate and it actually goes fairly smoothly, but it is a lot of kids. It's a lot of kids. And so we could really move, we could really move both of these programs forward a great deal if over the next few years we had the ability to add outdoor track and field facility, including a football field, you know, in the center of that track. The most likely place for this obviously would be on our Pink Hill property adjacent to North Middle School. So we would still have, track and football would still be combined programs, and we would move our, at the end of the school day, we would have our South Middle School athletes go up to North Middle School for those programs. But again, that's not a commitment. That's really essentially what it would take for us to feel comfortable expanding those programs. On the third page, we just kind of tell you some other thinking that we have. We don't have a specific solution for it, but we are approaching the point where middle school wrestling is really outgrowing the commons, the lunchroom of a middle school. And sometimes they'll be having practice and there'll be other activities going on in the gym. And if you're in the gym and you need to use the restroom, then you're either going around the wrestling mats or through the wrestling mats. So, I mean, moving forward, that's not an ideal situation. And then our high school program for wrestling, just as a side note, it's not high school's night, but they get a little, you know, there's always a little something there for high school. The high school wrestling program has grown significantly in recent years, and with the expansion of girls wrestling, they really are getting pretty tight at their current facility at the high school. So there might be a way to solve both programs in the same shot, but those are other things we're looking ahead to. And then just as the team got together and brainstormed other ideas that could happen in the future, we could consider 6th grade cross country. We could expand swimming and diving into the middle school. That would be a spring season, and so that might be a possibility. We could also expand esports. We've looked at archery program, which the strongest way to do archery would be an elementary and middle school angle on archery, and then we would pick up high school if there was demand there. So that's an interesting one that could actually develop into an elementary program as well. And we could expand club opportunities for middle school students to be engaged. We definitely feel like it would require an investment more to increase our stipends there. But there's some other challenges with that too. You know, it's tough to know how much stipend we would give to incentivize more staff to stay after school to provide the kinds of experiences that kids would want to stay after school for. So it's not just a dollars and cents issue there. It's also kind of a manpower there too. And then there's the age-old question: when do we split out the middle schools? We have some numbers. The schools in the larger school districts next to us that split out their programming, they have Independence and Blue Springs both have 4 middle schools that are all much larger than our 2 middle schools. And so right now we feel like we don't splitting programming between North Middle School athletics and South Middle School athletics isn't necessarily the solution. We feel like there are other solutions we can do as a combined program in the near future. I'm sure someday we'll be big enough that it makes more sense to split those programs, but it seems like there's a lot of other things we can do in the meantime. So, but we did invite Mr. Hart here to help answer any questions that anyone on the board might have.
Questions, anyone?
I have a question. On the other possible opportunities that could be presented, like 6th grade cross country, I would think the only additional expense there would be if they had enough uniforms. So is there anything else holding that one back?
For 6th grade for cross country, no, it's pretty negligible. I mean, it's
Right, like that could be an
pretty
easy
simple.
add. Yeah, so like that's what I was looking at, that these could be a low add, or same with swimming and diving, because that's, like, I know, I think a lot of our middle school students are already doing the swimming and diving through our high school track coach with the great, like, there's a summer program that's offered, and I think it's a feeder program into what we're doing, so I don't know if that would be too different either. Do you know if that one?
I don't have the exact numbers. We would have to get some more pool time, which would be some additional cost for that.
Right.
I know our swim coach is strongly advocating to help build her program at the high school level. We need to get those numbers started at the middle school. So there's not a lot of schools that have middle school swimming. I couldn't tell you the exact amount. It's more of an extracurricular, intramural type programming, but Platte County has it. Independence, I think, has it. I'm not 100% sure, but there's a few that have it. But I know that she's been advocating pretty strongly for it.
Yeah, and she's a great advocate for, because I know plenty of middle school students that are in that. And so it seems to be that the sport really is growing. And so that would be nice to be able to grow with it as well. So then this, with esports, again, is there any other, like, to make these things happen, like you had included in your other thing, what we would need for those? But this almost seems like a couple of low-hanging fruit that we could snatch onto, like.
Yeah, I mean, absolutely. You know, we're always trying to drive numbers, trying to increase our participation. The thing about Grand Valley, we don't struggle with getting participation. A lot of these schools that started the 7th grade programming was to help them field teams. We don't have that problem. So we have a lot of kids that participate here in Grand Valley, which we're very blessed with. So, but at the same time, we always strive for more. We want more and more participation. So yeah, those are some low-hanging fruits. So really the big ones, it's going to take some bigger investments and thoughts, or anything that's going to require facilities.
Thank you, appreciate it.
Are other districts doing 6th grade stuff?
I'm not aware of any 6th grade participation.
In
Most all of them are doing 7th grade and about everything. I'm not aware of very many 6th
So
grade.
the 6th grade cross country would just be something that we would do just to
I would have
encourage
to research
participation
that a
in
little bit more. I'm not aware of any other 6th graders.
On the
cross country.
on the track stuff, because track, the difference between girls volleyball and track price-wise is only about $1,000 difference. So that's mainly just a facilities situation.
100% facilities. We have 150. I'll try to paint a picture of what the spring looks like out there on our track. On any given day, we'll have 150 middle school, 8th grade track runners. We'll have another 150 high school. We have about 300 kids on an 8-lane track. We also have soccer that's going on out there inside that track. Those 150 middle school 8th graders get the last 2 lanes. The high school will get the inside 6. If I'm doing the long jump, I'm probably waiting in line. We only have 2 long jump pits, and I have 40 kids out for long jump. I'm probably waiting in line for 30 minutes to get a run at the pit. So it's not real efficient. So if we're really going to expand our middle school track, we're going to have to address the facilities
So
to
we're
practice.
we're not expanding to 7th grade because we don't have the space. Has there been any thought just to try to get creative with starting them doing things, working on things like handoffs or whatever in a gym or something like that, and going ahead and trying everything that we can figure out to go ahead and expand, you know, and give these 7th graders the opportunity, you know, so that and then you know, as we work towards, obviously we would love to be able to build a brand new middle school facility where it's not there yet. Do we have to wait until we get that before we expand to 7th grade, or are there some things that we can do creatively to, you know, with our gym space or just outdoor space that's not necessarily the track, and then shift groups or whatever? I'm sure you guys are thinking about those things.
Yeah,
but what are the-
especially in Missouri spring season, for the first 3-4 weeks, they're hardly going out to the track anyway.
Yeah,
It's too
exactly.
cold, so they're in
Right.
gyms all the time in the spring anyway. There has been some conversations with that. Some track coaches are really pushing to add 7th graders, and that they're confident they can do it. Others are like, I don't know, that we're going to be adding 150 kids in this gym. Can we be creative? Certainly. Where there's a will, there's a way. Our primary concern is always going to be safety of kids. So If we feel like we're putting in kids, they're throwing in, heavy objects and things like that, if we're gonna be putting them in a position where, safety's gonna be jeopardized, we don't wanna do that. So, there are some things that we can continue to investigate, using the gym, but there's no substitute for getting out there on a track or throwing a shot put or a disc or jumping into the sand. So,
What is the clamor, I guess, from parents or from others to expand to the 7th grade? Is it more from our coaches wanting that, or is it more from
I
community?
think it's a good question. I think it's a little bit of both. I don't get the 7th grade parents coming to me as much as Mr. Lyford would, but I know our coaches. We got a mixed bag there because our volleyball coaches, if I was to be honest with you, they were not as sold on adding 7th grade volleyball because you're doubling the kids that are trying out. That may result in more cuts, and so we've had some conversations with that. So our 7th grade programming, I think our coaches are all on board with it. We just want to make sure they're safe.
Yeah, I would think, from a coaching standpoint, building a program, starting younger, and building all the way up, would be something that would be advantageous.
Yeah, I think the
you
big
see
one.
that a lot, with different areas. They want to build as young as possible and teach those kids, teach them the right way, teach them how we're doing things or whatever, and develop that all the way through to get the best product, as they get to varsity level.
I think one of the bigger challenges is probably in the sport of football for us because as these surrounding districts add 7th grade football, then we don't currently have 7th grade football, and so right now we have these competitive teams or community teams fill that void. But the challenge is our 7th grade programs, those community GVSL teams, they're struggling to find competition because they're playing for their schools. The 7th grade teams are playing for their schools. So that's kind of a new phenomenon. We'll see. It might come back the other way, but that is a concern that we have with our 7th grade football program. Is those boys currently play for GVSL. It's been a great feeder program for our high school and middle school programs, but there are fewer teams that they can go out and find to play because they are playing for their middle school teams.
A question to that, is there a risk if we add that 7th grade program and then we cut the 7th grade kid, that then the likelihood of them coming out again 8th grade, right? So like when you cut early like that, then you can diminish the desire whenever they might not have been just developmentally there or those types of things. So I think, is that a concern as
Absolutely.
well
That's
whenever
been
you-
discussed.
So, like,
That's some
can you-
concerns of our coaches. They
Like
don't want to
for-
cut,
Right,
and
'cause
you know.
you're cutting a lot of kids, because how many kids came out for 7th and 8th grade basketball this year and how many were cut?
We cut about, the numbers actually weren't as high as I thought. I expected us to have more cuts, and they were pretty consistent. We cut about 22 kids, both the boys and the girls. We don't normally have a lot of cuts in girls, which surprisingly we had more this year in our girls program, but our boys are about 22 kids, which is pretty much what we've always had. So I was actually surprised. We didn't increase cuts, but we added programming. So that was great for our basketball program. But you're right, and our coaches will say, well, I don't want to cut a kid in middle school because next year he may grow 6 inches
Right.
and not come out. So at the end of the day, our primary concern, our primary focus for middle school is getting the kids involved. It's not about winning and losing, it's about participation and development. So, as they get up in the high school and the varsity level, it becomes more competitive, of course, but that middle school programming is all about getting them involved. So whatever we can do to enhance our facilities and our resources to get more kids involved, we will all benefit as a program.
Those kids that do get cut, are we funneling them? Are there other avenues like GVSL? For instance, if we added football, or if there's something that that overlaps? Is there ways for those kids to be able to
Yeah,
go find that
absolutely. I will tell you
sport
what, Coach Randy
elsewhere?
Draper is phenomenal at going around and picking up these kids that got cut from volleyball or got cut from these other programs. That's just one example.
So those are options.
Track,
There's
yeah.
opportunities, then those kids that
There are
really want to can
opportunities.
go out there and I know kids like even with varsity baseball and stuff are playing with other, if they get cut from our team, they're playing with other, different programs or whatever that are out there. I know kids that are going on playing college baseball that didn't play high school ball here, but they're playing college ball because they played with other. So there could be those options as well.
Absolutely,
right.
yeah. There's always people out there to help fill that void. Whether it's in the same sport, they might have to pay for it or go play competitive. Or, track is a great catch-all for us as well. If a kid gets cut from baseball, they may not want to run track, but, I'll find that once they decide to do it, in many cases, they end up liking it more. I mean, they have a great experience with it.
So I guess my one real quick question would be, do you feel like that adding some of these younger sports is going to be advantageous to our program, striving, getting better, improving, competing at a greater level, or is that not necessarily going to be advantageous for us to add at a younger level, starting them competing at a younger level?
I believe anytime we get kids involved, get them engaged with positive role models in our schools, it's going to be advantageous for our program. Get them to our program to where they understand the expectations and they understand that what's expected of them. But forming that chemistry in that with their teammates, their peer groups, that cohort group, that 7th grade group, that 8th grade group, and they grow up through the program with those same kids and getting that extra year of bonding. I don't think there's a substitute for that.
Thank you.
Good.
Yeah, this is actually, I think it's a good problem to have, kind of what you were speaking to, that it's not necessarily about winning or losing, but just getting the kids a place to hang out and be active with other good people and good role models. The 3 that I've heard most about, just I guess with the people I know, have been an additional volleyball middle school, an additional football, and then archery. And that's kind of come on, I'd say, this calendar year. There is a local archery shop that actually opened up stone's throw away from Matthews. So, yeah, but just glancing over the cost, I think for the result that we could get by getting more of these kids involved from a financial standpoint, I think the cost seems really reasonable for what we're trying to do. So I would be in support of as many additional middle school sports programs that we could do without creating a logistical nightmare for you or your staff. So, and I appreciate everything that you do.
Thank you.
Thank you. Dr. Welly, I think what you're probably hearing from the board is we'd like something actionable in the way of programs and maybe a timeline. Is that?
We will, anything that can be actionable for next school year, we'll just assume that that's part of our budget discussion for the next school year's budget.
Okay. Thank you.
Thank you, Mr. Hart. Oh, we got one more thing.
That's what I thought.
We'll let,
Let's see the
I was going to run as
coaching.
fast as I could.
Coaching stipends.
yeah, so Mr. Hart this is something he's got a lot of demand for, is to add girls flag football as a spring sport. The NFL is really behind this. They've already granted us some funds. There's also a grant that we've applied for, and the board is approving. They're acting on a grant tonight. They're acting on these stipends, but the grant that we're acting on, have you heard from the chiefs on I think it was a $6,000 grant? Did we get that grant?
Correct.
Okay, very good. So now you can accept it. So what we're specifically asking the board for tonight, to be able to move forward this school year with girls flag football, there's 3 coaching stipends totaling an estimated $4,190. It's for a head coach, 2 assistant coaches. And this is a seven-week program with 5 weeks of Saturday games, and they would start this spring. But I mean, certainly any questions, Mr. Hart's been working on this one, trying to make this happen.
Any questions?
Have we identified coaches? There are people that are wanting to do that already.
Yes, we have 3 that have reached out. Jason Finstermaker, Kylie Bomer, and Katie Kelly. They haven't been posted, but they have talked to me about it. I'll just say that. They have interest.
So this would be potentially starting in spring of '25?
Yes.
That's really cool, actually.
Yeah, I will just say, Dr. Welly, you already explained it. I have, this thing is going to grow, I believe, big time. I really do. There's 24 schools in the metro that's already offering flag football. Ray Peck was able to travel to, I think, Cleveland last year and play a showcase for the NFL. The NFL's pumping a lot. It's a brilliant marketing plan for them. They're pumping money into it to increase their fan base. But at the end of the day, the girls are beating down the door to get this done. I can tell you, speaking on behalf of a father of a junior, I think she had all of her friends come beat me up to try to start this flag football team. That's how I feel, because they're pretty excited about it, and they just want the opportunity to get out there and play the game.
First of all, I just want to say I'm very excited about this program, and girls flag football is one of the highest or the fastest growing sports, and the scholarships that are available for girls to go to college, it just opens another avenue for our students, so I'm very excited about that. My one question is that it says it's not going to be MSHSAA sanctioned until for maybe 5 years. Mm-hmm. How do we hold our students accountable in the realm? Like MSHSAA has very specific rules of what you have to do and the grades and all the things. How does that look if this is not MSHSAA sanctioned? Do we still go by that?
We still, one of the things that we do take pride in is we hold the same standards for all. We are consistent across the board in how we hold our kids accountable. So we have a lot of other non-MSHSAA sanctioned events and activities that, you got to come to school. If you're not at school, you're not going to play. You got to get certain grades. So we still can hold them accountable. I do anticipate it's going to be a MSHSAA sanctioned sport within the next 5 years. I mean, I can't predict the future, but I can see the trend. I can see, like you said, it's the fastest growing sport. You're seeing states all across the country adding it. It just makes sense. So I think it will be very soon.
I just wanted to check because I know MSHSAA has a very fine checklist.
They do.
And so that there's no wiggle room, that the expectations as a girls flag football player are the same as a regular football player or a wrestler.
I think it'll become an emerging sport within the next year. They got to get enough teams to participate across the state. I don't think it'll take long.
Any other questions?
Mr. Porter has a question.
Yeah, real quick. It looks like, just from your cost breakdown, that between the $6,000 grant from the chief as well as the $2,500 uniforms, pretty much this year is going to be covered in cost from what we've got there, correct?
Correct.
Okay. So it'll just look more like a budget item for next year more than anything as far as trying to find the money for it. Thank you.
Any other questions? I'd entertain a motion to approve 3 coaching stipends for girls flag football for spring 2025.
So move.
Second?
Got a motion and a second. Any discussion? All those in favor?
Aye.
Any opposed? Motion carries.
Thank you, Mr. Hart.
Thank you.
That will bring us to the 2023 bond project update.
Yes, in April of '23, excuse me, we passed a $32 million bond issue, and with the premium and interest, those bond sales generated $34.5 million. So that's the other number you have at the top of this report. The number one expense on that was our high school Phase 6 addition, which was the field house and other related additions and renovations. The next tier, the big things, were the heating and cooling units throughout the district and a new heating and cooling control system at all of our schools, and then the renovation of the baseball, softball field, really both fields, but the addition of a turf field, and then reconditioning of our grass field. And then there's a whole list of other things that we've done, associated projects. So the total as of December is 34.3 million, but you'll see that there was an asterisk behind the 25 million spent on Phase 6. That's because there were approximately $1 million of contingencies associated within that 25.7 million that were not needed. So that frees up $1 million down below. And so this other list that we were working on, the board had already authorized the first phase of window film, which is being installed at this time. Other items that are on there is when we got new lighting for the play surface of the football stadium, it's so efficient that it doesn't radiate light out onto the plaza anymore. So now we need to illuminate the plaza. If you've been out at a home game, it's just kind of a dark area from the gate around to the home stands. So we have, based on other lighting projects we've done in the district, we know that it's probably about $10,000 to improve the lighting there. And Dr. Gooch can speak to these more in detail, but classroom phones was one of our safety features that we identified, and he can speak to the capability of those. It was 8 or 9 years ago when we first installed cameras in our buses, so that equipment is due to be updated, and you can imagine the technology's gotten even more sophisticated in that time. We would do a second phase of window film security, and the specifics on that would be a closed item for executive session, where we can talk about the specifics there. And then another safety item is the exterior door numbering. And as you approach this building and you see how the doors on this building are numbered, we would apply that same system to all of our schools and all of our systems, and it's standard for emergency first responders. And then I skipped the item, the South Middle School bus parking lot. This, at $274,000, it's a large parking lot behind South Middle School, and it's a large enough sum. It's not something that would be very easy for us to take on as a capital project on the normal capital operating budget. It's a pretty sizable. We weren't sure if it was going to make the cut or not, but really, with us not needing about $1 million worth of contingencies, it makes it easier for us to say, let's resurface this parking lot now, so that it doesn't have to chew most of the capital out of an annual capital improvements project on a normal operating year. So the potential grand total is really within $10,000 of the available funds. But we wanted to get that list in front of you. Safety has certainly been a priority, and this last phase of expenditures before we retire those 2023 bonds really are an opportunity to move forward on a lot of the big items that were on our safety priority list that came out of the audit from last spring. So wanted to put that before you tonight.
I have a question. On the classroom phones, that would be a phone in every single classroom?
That is correct.
That's
In addition
amazing.
to a system that would also reside on every staff member's computer that would be able to go back and forth from the computer to the phone. If they were needing to be away from their desk, they could still answer the phone call on their phone. On their computer, excuse me.
This would be a hardware cost.
Correct.
There would be other costs associated with this.
This is a hardware cost and a first year of licensing cost. This is an all-in first year. Then there's an ongoing license cost. We currently have an ongoing license cost with our Cisco WebEx system. This is just, there would be, because the additional licenses, what we currently pay would just be a little bit larger moving forward, and then we would build that into future school year budgets.
But this would get a handheld phone in every classroom.
That is correct.
Which is very important.
It's like 300 and, I think the quote that we got was for 270 additional desktop phones.
Yeah, like to not have to intercom into every room and it be a whole classroom conversation anytime you have to call a kid out.
That's correct.
It allows teachers
privacy.
more access to call a parent on their plan. They don't have to go to a common area. Like, this is a huge, huge deal to me. And I think it's very important for staff.
Any additional questions or
It is,
discussion?
there's no action item with this tonight. The board would continue to see these as individual action items one at a time that would come back in contracts. They could be consent agenda if it's a large enough item, or we just wanted to talk about it before we voted on it. It could always be a new business item, but these would all be coming back in the weeks and months ahead.
All right, hearing no additional discussion, that would take us to the board policies. This is the first read on all of these. We will discuss them in February at the workshop. Any comments or questions regarding a specific policy? If not, I'll just move on. Okay. Are you reading this or am I? By all means, please.
I make a motion to adjourn and go into executive session as authorized by the provisions of section 610.021, number 3, 6, 13, 14, 20, and 21 of the revised statutes of Missouri. Disclosure of existing or proposed security systems and structural plans of real property owned or leased by the district would impair the district's ability to protect the security or safety of persons or real property, and the public interest in non-disclosure outweighs the public interest in disclosing of the records.
Got a motion and a second. Mr. Porter?
Yes.
Mr. Scully?
Yes.
You need a first.
She said
Did we have a first?
She did make
You did
She
make
made the
first.
she
Okay.
made the motion by reading that, yeah. Mr. Pollard?
Aye.
yes.
Sarah, okay. And I'm a yes. We are in executive session. Thank you all for coming.